I'll just jump right in. Research4Life, that's been mentioned many times, but I'm going to give you the one sentence. Research4Life is a 10-year-old public-private initiative to close the scientific knowledge gap between the industrialized countries and the developing world. And it does consist of 4 programs as of last year. The 4th program is not listed on here, but we have health, agriculture, environment, and then technology or intellectual property under WIPO. So our users, so they're in these qualifying institutions within these qualifying countries. So we have 2 groups, A and B. It's based on gross national income per capita. So if under $1,600, there are no fees involved. There's no charge. And if you're in Group B, then per institution there's a $1,000 charge for participation in these programs. But again, they're very poor countries, under $5,000 gross national income per capita. And I should also say that the $1,000, publishers have waived their right to that money. That money actually goes back into the program. So it's an important point to note. So how are the programs performing? Well, the best study that we've done was in 2010, and it involved online surveys, an institutional survey that was primarily responded to by librarians in the participating institutions, a general survey that included users and potential users, and site visits. We went to, a group of individuals went to 58 institutions in these various countries listed and had over 570 interviews. And what did we learn from this? Well, we learned that Research4Life is effective, highly valued provider of access, and that it can be characterized as one of the primary means to access research publications in the developing countries today. So Phil might say, how do you say that? How can you support that? Well, we support it because the health and agriculture components of Research4Life, respondents noted that for those that they were the most cited source and also the most frequently used. And the health component, or HINARI, even beat out PubMed. And if you're beating out PubMed in the health area, that's saying something. However, it's not heavily used. The general survey respondents, only 30% were aware of Research4Life. In fact, it's so bad that a lot of folks who responded to the general survey decided, from responding to the survey, said, hey, I might start to use Research4Life because of... So the survey itself was promotional. So like, oh, okay. But those who do use Research4Life, they use it heavily. We had 20% who've used it at least 1 to 3 times in the last 30-day period when the surveys were done or interviews were conducted. And 56% had used it at least 4 or more times in the last 30 days. And then we had 44% that was over 10 times in the last 30 days. So there is heavy use amongst those who are onto it. How are we reaching the non-users? Well, primarily it's happening through email from a variety of sources, friends, colleagues, or folks are finding it on their own. So not through any organized promotion, they just are searching the web and they're finding it. In talking to, in responses from the institutional surveys, librarians noted that most of them had not conducted any organized awareness raising or outreach activities in the last 2 years. So clearly an area where we can work with the librarians or the primary contacts in these institutions to try to encourage promotion. When we get into how folks are accessing research information, no surprise here, the internet was the top means. So what are the challenges when you're using the internet? Well, again, no real great surprises. We're looking at the general survey results, and so internet speed was the top, but right behind it was accessing relevant sources. So find something, but then being able to access it. So we're like, okay, this is interesting. Now let's focus in on the actual Research for Life users and see if there's something different. And lo and behold, just nosing out internet access or internet quality was discovering and getting access to information that they're finding. And so this is from the folks who are actually using the program. So we're really hoping that that number would go down for these users, but it's not. Also, issues with logins, password problems was another issue. So what are the challenges? And this really ties right back into something Alicia was just talking about. There's sort of three areas, three causes. One is internet connectivity, telecommunication issues. There are problems with the website. We found that because there's a lot of respondents saying they had issues with passwords. And then publisher policies in relation to access for specific countries. And there's really no way to tease those three out to figure out what the impact of any one of those three. But we've been very active in trying to address what we can. One of the things that we've initiated, and again, Alicia mentioned this, is a customer relations system. We're finally bringing that up so that we'll have a system to really help us, one, manage and better manage communication with the librarians and primary contacts in these institutions, and really try to get more of a dialogue going, making sure that we're in contact and finding out if usage drops off in an institution, what's going on, and pushing out information. This system will also allow us to consolidate the registration. We have the 4 programs, but we're going to have a single registration, a single password. That's going to hopefully be a big help in that. And of course, if they can implement Shibboleth, that would be even better. We're redesigning the web portals to hopefully make them more user-friendly, intuitive. There's been a lot of work by a training committee to post more information in terms of online training modules that can be used. And then there's various conversations that are going on with the publishers about some of the restrictions in various countries. We're seeing what we can do, and if there's ways to be more granular. There's also conversations underway of what happens when a qualifying country sort of graduates from the program and moves above that threshold. How do we handle that? And so there's conversations now that are going on to try to think about some creative ways to maybe extend some access to those folks. So a lot going on in that area. Now I've just been talking about 2010 data, but to show you something no one else has seen, ta-da, you're welcome, Phil. See, I listen. I'm a librarian. I listen sometimes. One of our newer partners in the program, and we're always looking for new partners, is Sweats, and they're providing an application that allows us to consolidate counter-compliant usage statistics. And so we've just started to load data. And so I only have data for the health component, HINARI, but that is the largest program. In 2011, for the publishers who were able to pull in counter-compliant statistics, we had 5.7 million article downloads. So counter-compliant stats, so stuff's getting used. And you can see I just broke this out by some broad subject areas. This is through the counter stats and the Sweats site. But okay, so 5.7. How does that compare to anything? Well, I did check Yale University stats. I have access to that. And I compared for the publishers and platforms. So I was looking at the same basket or same bundle of content. And Yale came in at 4.9 million article downloads. It was for the fiscal year as opposed to calendar year, but again, I was still looking at a 12-month range. And frankly, I was really hoping the world was going to be stomping Yale a lot more than it is. I mean, only 800,000. So I think it ties back into the 2010 results that we could be seeing a lot more usage. There's certainly I think the possibility for that. In wrapping up, I just want to give a thanks to some of my colleagues. What folks don't know is a lot of the data entry, the links on the user portals, the subject designations, all that's done manually at this point. So a couple of my colleagues at the Yale Medical Library, Melissa Van Tyne, who does a lot of data entry, Jeanette Ponzio, who's been there for 45 years, she does tremendous work. She just loves it. Unfortunately, she refuses to be photographed, so we're missing her. But then Chris Melnick, she is our cataloger. So if you use the HINARI website, all of the subject assignments are done by her. Tremendous work she does. And finally, yes, I think it's certainly a very valuable program, as demonstrated through the use of the programs, but we certainly have lots of ways to improve it. And there was a screenshot that Alicia did of sort of testimonials. This was something we put together and published last year. And these are from researchers, clinicians around the world who use Research4Life. And as a publisher that participates in the program, thank you. I don't think librarians thank Elsevier enough for the wonderful things you do. Okay? I mean, come on. Yes, I'm a librarian. I said that. But I would just say to every publisher in the room that participates in Research4Life, you should read this. You should take a look at it. It'll make you feel great. And if you're not, you can read it and you can say, wow, this is something I really want to be a part of. Thank you.